Assalamu alaikum dear doctors. In this video I am discussing about faltering growth history and discussion from Dr. Muhammad Abdullah Khidr book. And when there is any patient complains that failure to thrive, what are the differential diagnosis first come in your mind? Number one, that is decreased intake due to any social factor, neglect or maternal depressions, any poor parental skills, poor feeding and behavior problem, and food refusal. Number two, malabsorption causes, that is including pancreatic insufficiency, cystic fibrosis, Schwarzman-Diamond syndrome. Then acquired enteropathy, that is post-infective any cow's milk protein allergy or celiac disease, and inflammatory bowel disease. Increased loss. Why an increased loss? That is any diarrhea, vomiting and gastroesophageal reflux disease. Number 4, low genetic growth potential, that is familial, small for gestational age and genetic syndrome. Number 5, any increased energy expenditure, that including any chronic illness like renal failure, liver failure, congenital heart disease, endocrine problems, hypertension, asthma, immunodeficiency and malignancy, and iron deficiency anemia. Now, what to ask in the failure to thrive history? What we ask? We take the growth history in details, and including the questions are: time at which weight becomes static, any preceding illness, is it significant weight loss, did you check in the clinic, anyone told you weight and height in huge centile, have you any growth chart, what about last height and weight, any concern regarding his parent height or weight, anyone did his meet parental height, did you have any follow up? Any follow up with the dietitian? What intervention he did? What is the side effect of the interventions? Then we take the nutritional history in details. That is, tell me about his feeding since birth till now. What type of milk given? Breast milk, formula milk, or any cow's milk? And how many times per day? If weaned, time of weaning, is it smooth or weaning? If in formula or cow's milk, how you prepared? Volume given each field. If solid food started, time of introduction of the solid food. How much of diet still consists of milk? What type of food you start? Any recent change in food like introduce of eggs, wheat, how many meal per day? How much amount? Have you any food diary? How taking feed orally or NG tube? Who is given feed? Any difficulty with feeding process like any shortness of breath, uncomfortable, any difficulty with swallowing or chewing? Is he vomiting immediately after feed? Any history of food allergy? Systemic review, that including the clinical features of the celiac disease, cystic fibrosis and chronic illness. So in systemic review we exclude, is it celiac disease, failure to thrive, or cystic fibrosis reason, or any chronic illness. So GIT symptoms we ask, what about the bowel habit, stool frequency or consistency and color, does it contain food, is it sufficient to flush, does he vomit, if vomiting frequency, character, is it associated with food, is she nauseated or anorexic, what about her appetite, any increase in her tummy size, history of any jaundice, chronic liver disease. Then respiratory symptoms we ask, is he had any cough, difficulty of breathing, or history of any recurrent otitis media, immunodeficiency we exclude, and also cystic fibrosis from that. Generally we ask the activity, sleepiness and pallor. Musculoskeletal system we ask any skin spot, joint pain or swelling, and immunodeficiency, any disease or not. CVS we ask any swelling in feet, difficulty of feeding or sweating associated with feeding, bluish discoloration of the baby. CNS we ask any abnormal movement, any weakness in any part of the body, bulbar and pseudobulbar palsy. Urinary system we ask any concern regarding his urinations, how many wet nappies he has per day, color and smell of the urine. Past history we ask any previous illness, history of any jaundice, chronic liver disease, hospital admissions. Parental history we ask any concern regarding his pregnancy, what is the mode of delivery, birth weight and gestational age, any difficulty after delivery. Drug history we ask what is current medicines, any drug allergy. Vaccination history we take, development history, any developmental delay. Family history we ask any similar conditions, our parents' health status was okay, any history of psychiatric illness, is your husband, is your relative, how many members in the family, how many children you look after. Now social history we ask the personal seeking for the cause of failure to thrive, job of the parents, education of the parents, what is age of the parents, is your husband live with you, stable marriage, who's taking care of the patients, maybe mother is busy, anyone else helping in taking care of him. Economic history we ask that is the money income satisfy your needs, any financial support. Then we take environment history. Smoking history, that anyone in the family smoking or alcoholic or any drug abuser. Housing like rented house or owner, how many rooms you have, animals, have you any animals at home. Impaction of the disease on family, social isolations, impaction of the disease in the baby, growth, development and activity. Now discussions. What we mean by failure to thrive. So an infant or older child who fails to gain weight as expected, growth below the second centile, or a change in growth that has crossed downwards to measure growth percentile in short time, 4 months or more. Management is first we do the investigations, that is stool analysis. We see the culture sensitivity microscopy for ova, cyst and parasites. Urinalysis, that is for protein, nitrates and blood. CBC and film, WBC and ESR. Iron studies, that is chemistry, urea and creatinine, then bicarbonate, calcium and albumin level. Screening for celiac disease, we see the tissue transglutaminase, autoantibody and immunoglobulin A. Screen for the cystic fibrosis, sweat test. Imaging, chest X-ray, bone age and GIT imaging and endoscopy. And multidisciplinary team we involve can be managed as outpatients. So we involve the dietitians for the calorie assessment, record the height, weight each visit. Child psychologist consultations, evaluations of the child's cognitive development, food refusal and family dynamics. Also you involve the gastroenterologist. Treat the cause. If social problem responsible, then admission to the ward for good weight gain out of home environment. GP, health visitor, social worker support and community nurse provision. So this is all about the failure to thrive history and discussion. Thank you.